Hello, and welcome to iClear Smart Talk episode 5. In fact, this is not just another conversation, it's a moment I have dreamed about. It's one of those milestones you quietly dream of but never expected to come true. Today, I have an incredible honor of sitting across the person who shaped my way of thinking in endodontics and as well my approach to discipline, patience, and precision. Someone whose books I studied, whose philosophy I absorbed, and whose excellence continues to inspire me every single day.
Thank you for such a nice introduction. It is my pleasure, my privilege, my honor to be here together with you.
To call you a guest feels far too little. Today at iClear Smart Talk, I welcome my mentor, my teacher, and an iconic figure at Global Endodontics. Welcome to Albania, Professor, and welcome to iClear Smart Talk. It's an honor beyond words having you here with us.
As I told you, I'm very happy to be here, and it's an honor for me also to be here with you.
In fact, we have a lot to talk about, starting from your journey, then continuing to the global legacy you have created, and then to the wisdom you have shared with generation of clinicians. But let's start smoothly. Can you get us to the beginning? What led you to endodontics after medicine and dentistry, and how did your experience in Boston with Professor Schilder shaped your clinical and educational philosophy?
Well, let me tell you that my experience, my month spent with Herb Schilder, Professor Schilder at Boston University, as I consider the best time of my life and the time that changed completely my life. Let me start from the very beginning because my father was a dentist and I went to medicine to get the specialty in dentistry because my idea was to replace my father in his office, which never happened. I went to his office several times for my amalgam filling or other restoration, but not as a dentist. And this is because after my study at the high school, which was in Pistoia, a little town near Florence, but then I decided to go to university in Florence. And going up and down from this little town was not comfortable, was not easy. And then, thanks to my family, they invested money to let me live for years and frequent the university lecture in Florence. And then after graduation in medicine, I started to go to the specialty in general dentistry. It was also a specialty in nothing. Nothing so special. But during this so-called specialty, I realized they didn't teach me what I was waiting for, almost nothing. So at the end of these 3 years of experience, this is when I started to fall in love with endo, because being a physician, I could practice during my specialty on a patient, and my practice was mainly extraction, because I was asked to do extraction of teeth with the granuloma, with the cyst, with the knee lesion. And then I asked myself, how cannot be and find something to keep these teeth in the mouth of the patient? So I started to look for articles, a textbook, and originally the first textbook I found they were a textbook from people coming from the Swiss school. And so medication after medication, iodoformic paste, calcium hydroxide. But then it happened to me to open the textbook and the chapter of Dental Clinicus North America with a chapter on cleaning and shaping and then another chapter on obturation written by Professor Schilder. And I was so naive at that time that in my imagination, I was thinking that Professor Schilder was so excellent to be able to introduce instrument at gutta-percha point even in lateral canals. I said, this is a magician. I need to know this guy. And when I met him and I started to approach the technique, I was kind of disappointed because there was no magic, because the irrigation can clean all the space and remove bacteria, partition, and everything. And then the obturating material, following the law of physics of hydrodynamics, will fill so there's nothing magic. But at that time, all the people were saying, the Schilder's technique is so difficult, so time consuming, and was exactly the opposite. So I started to take all the continuing education courses in a sequence, one after the other.
Mhm.
And this was from July in 1978 until the very last on July 1980. And this is when I asked Professor Schilder if he could stay 4 months in the clinic, following the lecture, doing some research and the scanning electron microscope, but mainly working on patients. And this is how I learned, and I already knew the Schilder's technique, but this is how every single day from every single patient, I learned something. And so that was an experience unforgettable. And this was the best time of my life. So that after, when I came back, after the experience in Boston, at Boston University with Professor Schilder, when I went back to Florence, where I'm now, originally, at the very beginning, I spent 4 years in a dental office, downtown, beautiful office, beautiful patients, a very famous family from everywhere. But the office was based on prosthetics, dental technician, impression material. I hate that. I wanted to be responsible of something that I was able to do. My gadapercha in the root canal. So when I was still following the continuing education courses, going up and down to Boston and back in Florence in the office of general dentistry, but I was starting to receive patients from my teacher at the university, at the dental school, who were sending me patients just for endo. And so I decided to limit my practice. Coming back from Boston, I decided to limit my practice to endo. I say bye-bye to the beautiful office, the dental technician, the impression material and everything. And I moved where I'm still now after 45 years, receiving patients just for endo. Of course, things have changed through the years because at the very beginning, I had an enormous waiting list of people sent to me for endo. And then I start, because I love to teach. I
Yeah.
love to document.
Exactly where I want to
And-
go. Go
okay.
bigger. Let's talk a little bit about your global impact. You have lectured in over 70 countries.
72
Yes.
to be more precise.
72 to be more precise, yeah. And
Where
you-
I've been there at least once in some country, like here, for instance, this is my second time.
Mhm. And you have taught generations of clinicians.
Yes.
Yes. I am very curious to know, how do you reflect today on the role you have had around the world?
Well, I feel a big responsibility because I've been teaching to so many people all over the world. And everywhere I go, I meet people and they say, oh, Dr. Castellucci, thank you for your teaching. I think of you every day, have your textbook. So I'm very happy and very proud that I have diffused as much as I could the knowledge and the experience to share my impression and to share what I learned from Boston University and what I learned from seeing my patient every single day. As I told you, I like from the very beginning to document my cases and to share my experience. I don't want to keep any secret for me.
That's impressive. That's the thing I like the most. And that's how you inspire me every single day. Now, let's talk a little bit about the one I prefer to call evidence based dentistry. You
Yes.
are the author of some of the most respected textbooks in the field. I would say you have helped shape the protocols of what we do in our endodontic daily practice.
Yes.
How do you see your role in building exactly what is called predictable evidence-based endodontics that clinicians all over the world now rely on?
Okay. Now, predictability is one of the many things that I learned from the mouth of Professor Schilder. We want predictability. So I want to be predictable. I want to have my patient coming back for the recall evaluation with the complete healing of the lesion, the swelling, the pain. Everything should be just memory, just it should be gone. And this is what I like to transfer to the students. I teach in my facility. I teach in several universities in Italy. I've been invited in many universities outside of Italy. And just to give you an idea, last year I went for the first time in China, and the title they gave me for my lecture, Dr. Castellucci will tell us all the secret about endo. And then I said, I'm sorry, but there is no secret. What I like in the Schilder, let's say, philosophy, is that everything is so logic, from how you make diagnosis, how you prepare your access cavity, how you clean and shape and obturate. Everything is very linear. Okay, is logic behind this and knowledge. Speaking about evidence base, everything I wrote in my textbook is very well documented with a lot of bibliography. I didn't invent anything, and is well documented by the reference and by my clinical cases. So if I say, for instance, when we do surgery, we don't have to remove entirely the granulation tissue or the 60 wall. Maybe doing this, you can damage the vital tooth next to the one involved with the lesion. So sometimes I have a case documented in my textbook. I intentionally leave part of the cystic lesion in place. And then after a few years, I have the complete healing documented in the bidimensional X-ray and today with the CBCT. So everything is very well documented, I repeat, with references, many references, and many clinical cases.
Thank you. Impressive. Now let's move to my favorite questions. How have you kept your mission alive after all these years? What drives you still after such a long and accomplished career? Because from what I've seen and personally felt, this is something that goes far beyond anything monetary. It feels deeply human, almost spiritual. What do you think?
I think that you said exactly what I have inside here. I don't care about money. I am visiting professor in several universities where I don't get any reimbursement for, not even for the train or the hotel sometimes. But I don't care. I like to transfer my experience, my knowledge, and what keep me alive and full of energy and enthusiasm is the audience. When they stay hours listening to me and then asking questions, that means they are very much interested and very much involved. And this is what keeps me alive and full of energy. One of the best compliments that I receive anywhere I go, like it happened a few weeks ago in Kuala Lumpur. I was in Malaysia. And someone came to me and said, Doctor, I have to congratulate. How comes that you have, at your age, forget about the age, forget about the number, but how comes that you have such an energy?
This burning fire.
Yes, because I have fun. I like it. Maybe it's my favorite work. I do two things in my life. I treat patients and I give lectures. But just between the two of us, most of the time I treat patients to collect cases to show during my lectures. So the patients are a good excuse to have always new cases. The cases that I showed you at the very end of my lecture today are cases that I treated only a few weeks ago.
Yeah.
So I don't have a recall evaluation, but I always try to bring new material. I'm sick and tired to listen to my voice and showing the old cases million times. So that's why I'm always looking for something new. This is the reason why, even though I have the age where many of my friends at the high school, at the university, they already retired. They don't do anything. They just spend their life doing nothing. Not me. Okay? Because I still enjoy what I'm doing every single day. Every new patient is a new case. Is a game between me and the patient, and I want to be the winner. I want to solve the case. I want to retrieve the case. I want to maintain the tooth in the socket.
In a perfect way. You are a perfectionist.
Yes, I'm a Virgo.
You know me as well.
And I know you. So we are perfectionists. So the word more or less or about is not in my vocabulary. I want to finish at the working lead
Exactly.
right there, okay? And more or less, maybe half a millimeter, maybe 1 millimeter. No, right there.
Thank you. Let's drop now to your academic vision. I know that you have built the Microendodontic Center for Teaching in Florence. I would like to know more about the vision behind this academy and what are the principles that guide your approach when teaching clinicians toward excellence.
Well, let me tell you that I repeat more or less the same concept that I told you so far.
Yeah.
I like to teach. I don't like to keep the secret just for me. I remember one guy who, after taking the lecture in my training center, he spent one day in my office watching me working on patient. At the end of the day, he said, Doctor, I need to congratulate because you do exactly what you are teaching every day in the facility. He said, of course, I can teach one thing and do something else. It's not natural. It comes spontaneously. I have colleagues, excellent, beautiful picture, beautiful presentation, beautiful slide cases, but the audience, many times they come to me after the lecture and they say, yes, wonderful speaker, but what did I learn? Nothing. Just admiring the. Let me tell you a story so you understand what kind of person I am. In the 1983, we had the first meeting of the European Society and the Italian Society. I was a member of the committee. I participate to the foundation and the starting of the European Society. So we had the first meeting in Venice, 1983. I was very excited because that was the very first lecture that I gave in front of people outside of Italy, from France, from Germany, from England, from Switzerland, from everywhere. Okay? So I gave my lecture in English, very, very nervous, very excited. And at the end of my lecture, the representative of France, Dr. Crusoe, came to me and he said, Dr. Castellucci, congratulations, you gave a very nice presentation, but be careful because if you speak and you teach like this, then people will understand. I said, what? What do you mean? Of course, this meeting is made to let the people understand and go back home and practice on what I just said today. So this is what I have in my mind. I want people to listen to me and understand, go back home and do practice. Few months ago, I gave in my facility a lecture and workshop on microsurgical endodontics. I like the title. Micro because it's made with the microscope. Surgical but endodontics because it's an endodontic treatment made through a surgical flap. It's not just surgery. Okay. 1 week after the course, the participant coming from France sent me a WhatsApp, very happy, very excited because for the first time in her life, she made surgery on a lower molar after attending my lecture. I said, wonderful. This is what the lecture made for you to learn and then go back and practice. This is what I have in mind.
That's why people love you. And that's why dentists all over the world, when we mention the name Castellucci, they are like this, wow, yeah, the iconic one.
Wow. Now, let me tell you another story that came just to my mind now. I was in Malaysia, in Kuala Lumpur, together with my wife, Sandra. I was lecturing, and she was visiting the city, the skyscraper, the beautiful area, having a bag with the name of a dental company. I will not mention the company, but she was going with the bag and someone saw the name of the company. So this guy asked to my wife, are you a dentist? She said, no, but you are carrying a bag of a dental company. Yes, my husband, she said, is a dentist. Where do you live and what do you practice? Well, I live and my husband practices in Florence. What's the name of your husband? She said, Dr. Castellucci. Oh my goodness, you are the wife of Dr. Castellucci. Congratulations, million compliments in the middle of, of Malaysia. Unbelievable.
Yeah, you have to believe it.
Yeah.
It's all over the world the same feeling, even here in Albania. And now let's reflect about Albania. We are at the end of the first day of the masterclass, and it's the first time that you are leading a masterclass in Albania.
Yes.
How was that experience for you at the end of the first day? What impressed you most about the doctors here? And based on the training today, what do you think we can improve to move forward?
I was really impressed by the time. I finished my lecture starting at 9 o'clock this morning. I finished lecturing at 7 p.m. And all the people were still there waiting for my presentation, my cases. And they asked many very excellent questions. No stupid question at all. Beautiful question, which means that they were very much motivated and interested. This is a good point. Okay, so I hope I convince some of them who are still thinking, should I buy the microscope, yes or not? I hope I convince them to buy the microscope, because in the dental school and university in US, it became mandatory to teach the student the use of the microscope, because endo is taught and is practiced with magnification. No loops, no naked eyes, we need magnification. So I hope that many of them already have the microscope, and some of them, they are still thinking maybe they will install the microscope in their office. The microscope will change their life.
Thank you. To stay at this point, please give us a message to the young endodontists just starting their career in how to keep their fire burning, just exactly you have done all over these years.
Very easy. Remember that endo is not boring at all, because, as I said during my lecture, every patient is different from the other.
Every anatomy.
Every anatomy is different. Every tooth is different. Every root canal is different from the other. So I'm always looking for some new experience, something challenging, and I want to be the winner. So don't relax. Have a clever dental assistant that will assist you, because this job is made from two people, two brains, 4 eyes, and 4 hands. And the dental assistants should know exactly what I mean and what I need in every single moment. So the young dentist, don't think about the implantologist that by the time you start to negotiate a difficult canal, he will put 4 or 10 implants into the mandible. Forget about this, okay? We don't live, and I don't live only collecting money. I live by satisfaction. And when I say that I have a long list of patients who love me, men and women, it doesn't make any difference, because I saved their teeth. I kept them far away from the implantologist, and now they have their teeth in the mandible. They love me, and this is the big satisfaction that I have.
Now, to end this session, I have a last question.
Yes.
How does it feel for you to be here today in this podcast room, being interviewed from someone who once sat in your classroom? What does this experience represent for you?
Well, I can imagine I had the same experience when I was at Boston University speaking with Professor Schindler. I have a goosebump.
Yeah, me too. I'm excited.
Spending my time and listening the voice and the word of Herb Schindler, I think you have the same feeling now listening to me. I feel like I am a very normal person. I enjoy writing books. I enjoy giving lecture. By more than a professor far, far away, I am Arnaldo. Very easy, very simple.
On its very best way. And
Yes.
thank you for being this person that you are. Thank you.
Thank
really.
you for inviting me here and for this interview and the conversation. Thank you.
Thank you so much. Now let's move to another sessions. We are going to have 5-minute quick shots, but we are going to enter a more personal space. Are you ready?
Okay, let's see how personal you are.
What keeps your inner fire alive beyond the world of endodontics?
My secret, you know what it is?
Yes, tell me.
beautiful, a young wife who doesn't complain if I spend my time preparing my lecture and writing textbook. This is my secret.
Nice answer. Through the decades, what has truly been your mission in life?
Well, my mission in life is to do exactly what I'm doing every single day. Documenting, collecting nice cases, and give lecture to share my experience and my knowledge with a young dentist. That's all.
Professor, could you describe the man behind Castellucci, not the doctor, in 3 words?
Barbecue, Florentine steak, ice cream, and vacation on the beach. That's
Nice,
all.
nice shot. Thank you. Thank you so much. How have you managed the balance between work and family all over these years?
You need to have a person next to you, next to me, who will understand what I'm doing. And this is what I told you a few minutes ago. The secret is to have a young wife, but very clever, who doesn't complain. She understands exactly which one is my mission, and why many times, like now here, I am by myself. She's by herself in Florence. She's not complaining, oh, you leave me alone. No, go and come back to me. Of course, I will come back to her. Always. I love her.
Thank you. And now is the last question from the 5-minute quick shots. At this point of life, what does happiness really mean to you?
Happiness is the recognition from the people all over the world. When they hear my name, they say, oh, my goodness, Dr. Castellucci. And they respect the maximum they can. So everywhere I go, I have the same recognition. All my patients, they love me. They come for very happy for the recall evaluation. This is what keeps me alive, full of energy. This is my fire inside.
Oh, thank you so much. I can't believe that how fast the time has passed and we have arrived at the end of this podcast. I would like to thank you from the depth of my heart for sharing your remarkable journey with us. It's inspiring to witness a passion that still continues to shine bright. Your story reminds us that the true fulfillment in life happens when work and when passion and mission walk hand in hand. And beyond that, for me, this moment is a full circle moment I would keep forever in my heart. Thank you so much.
Thank you for this wonderful experience. I will never forget what you organized, the invitation, the people attending my lecture, asking questions, and spending the time with you and all the audience. It was a big experience. Unforgettable.
Thank you once again. And for the listeners out there, I have a closing message. When passion ignites the heart, purpose shapes the journey.
This is true.
Thank
Absolutely
you so
true.
much, bro.
Thanks to you.